Can you define for me what actually is endometriosis?
Very simply, endometriosis is a condition where tissue that looks like the lining of your uterus is somewhere it's not supposed to be. That lining of the uterus goes by the name endometrium. So this is outside the uterus, so we give it the name endometriosis.
Some of the tissue that's supposed to be inside the lining of the uterus decides, that's nice, I'm not going to do what these other people are doing. And so it actually ends up inside your pelvis. That tissue isn't necessarily just limited to your pelvis. It can travel and invade your bladder. It can invade your bowel. It can invade your diaphragm.
Why is that a problem?
As many women know, whenever they're on their cycle, many women get cramping pain, they get bleeding. Well, imagine that occurring at other sites in your body. That causes inflammation, it causes some scarring.
Chicks who have endometriosis have pelvic pain in a whole nother way. Some people have pain that only comes when their cycle comes, when that lining dies, and you get these inflammatory changes, and some ladies have pain the entire month.
Can you walk me through the symptoms?
We refer to them in medical terms as the 3 Ds. Dysmenorrhea, which means painful cycles. Dyschezia, which many women don't know that is painful bowel movements, especially when they're on their cycle. And then probably the most distressing to some women is dyspareunia, or pain with intercourse.
And once you do come to endometriosis, what are the treatment options?
You want to do whatever you can do in order to be able to decrease your levels of inflammation. So the first go-to are NSAIDs, your ibuprofen. Exercise plays a role in your perception of pain with endometriosis. And there are supplements that you can take in order to be able to decrease the inflammation that exists inside your personal space.
From a medical perspective, anything that stabilizes your rate of estrogen works. Estrogen feeds endometriosis, so anything we can do to control that is going to help that. Many women will use an oral contraceptive pill. There are second-line medical treatments. There's a hormone that comes from the brain called gonadotropin-releasing hormone. The other medications we use block the action of that hormone, so it stops feeding the endometriosis, which is our goal.
You approach the patient in a stepwise fashion, looking at what their symptoms are and how they present, and then you work your way through trying to find something that brings them improved quality of life. It's a diagnosis and it's a disease, but it's not the end of the world.
I would say the large majority of women, we can get to where they can live their life in health and happiness and only have endometriosis be something that they have to take care of with a medicine or with some treatment.